Today we will continue about urinary system, medical terminology, chapter 8, part 2. Urinary system at a glance. Functions of urinary system: maintain stable internal environment, remove waste products, adjust water and electrolyte levels, maintain correct pH. Now we will write the label for this figure on the number line provided. Here about what we talk about in the last week. Who can give the name of number 1? He can unmuted the mic and called what's number 1. I'm waiting for your participate in write or say what is number 1. Dear colleague, you hear me?
Yes, doctor. We write in the chat.
Yes. Yes.
This is a kidney.
Yes. And number 2?
Ureter. Sorry, bladder.
Yes, urinary bladder. And number 3?
Ureter.
Ureter, not the ureter. Ureter.
Ureter. Okay.
Two ureters. And number 4?
Urethra.
Yes, male urethra.
Male
and number
urethra.
5?
Female urethra.
Yes, excellent. Thank you. Here we see the Da Vinci robot surgery equipment. You know, this high technology for accurate surgery for neoplasm or tumor surgery in the like prostate and bladder cancer or adrenal cancer or adenoma. It's very advanced equipment for accurate surgery. It's called robotic surgery or Da Vinci surgery. Now, word building with a cyst or cysto. Algia, like cystalgia, it's the pain of the bladder pain. Ectomy with cystectomy, it's mean excision of the bladder or remove the bladder, like a radical cystectomy for the bladder cancer. Cystogram, it's mean record of the bladder or the X-ray or imaging the bladder. Cystic, like a bag or a cyst or sac pertaining to the bladder. Itis with cystitis, bladder inflammation in the called cystitis. Lith, cystolith, bladder stone. Word building with a cyst also. Cystostomy. Cystostomy is meaning a new opening in the bladder, and cystostomy incision into the bladder. It's the difference between cystostomy and cytotomy. Incision of the bladder by the surgeon, and cystostomy, new opening the bladder for drainage or by iatrogenic trauma of the bladder. Pixie, cystopexy, like in some cases of urinary incontinence in female or in the male, to bladder fixed it to the pelvis or retropubic fixate. Surgical fixation of the bladder. Blasty, cystoblasty, surgical repair of the bladder. Ragia, cystoragia, like hemorrhagia, rapid bleeding from the bladder. The hematuria, the origin from the bladder, called cystoragia. Scope, like cystoscope, it's an instrument to examine inside the bladder, called cystoscope, and cystoscopy, the act of the cystoscope, the examination of the bladder. Word bed with the litho, like extra corporal shockwave lithotripsy. It means the apparatus we can crushing the stone from the kidney or the ureter from out the side of the body. Cystostomy and tripsy and otomy, lithotomy. Cystostomy, a new opening in the bladder, like suprapubic catheter or cystofix. It's called also cystofix. Lithotripsy, surgical or technical crushing of the stone. Sometimes we use surgical instrument for crushing the stone or technical crushing of the stone. Lithotomy, meaning incision to remove the stone, a surgical operation to remove the stone, lithotomy, like pyelolithotomy or nephrolithotomy. Word building with nephro, like nephrostomy catheter. It's a tube between the pelvis and the skin of the body. Megaly, nephromegaly, it's meaning kidney enlargement. Nephroma, it's mean kidney tumor. Oocyst, nephrosis, it's mean abnormal condition of the kidney, which wasting of the protein from the body. Ptosis, nephroptosis, it's mean dropping of the kidney, like pelvic kidney, where the kidney stay in the pelvis. Nephrostomy, like the tube we see it in the figure here. New opening into the kidney through the skin. Word building with nephro. Nephrotomy. Nephrotomy, the incision into the kidney, direct incision to the parenchyma of the kidney, called nephrotomy. Nephropathy, it's a kidney disease. We talk now about nephron, the small unit of the kidney. Nephropexy, surgical fixation of the kidney. Lithiasis, nephrolithiasis, condition of the kidney stone. Sclerosis, nephrosclerosis, kidney hardening in the other disease. Word building with reno or uro. Urologist is the specialty of the urology. Urine specialist or specialist in the urinary system, which contain of the kidneys, ureters, bladder, urethra, and male genitalia. Uremia, urinary blood condition, it's called uremia. Renal pertaining to the kidney, it's also like kidney. Word building with the ureter or ureter. We have two ureter, each side of the kidney, and sometimes we have a duplication of the ureter or bifid ureter and pelvis. Ureteral pertaining to ureter. Ectasis, it's mean ureter dilatation and the urine stay for a long time in the pelvis or on the ureter. Lith, urolith, it's ureter stone. It's the same meaning of ureter stone. Stenosis, ureteral stenosis is narrowing of the ureter. There are physiologic narrowing of the ureter, and there are acquired one. Word building with urine. Urinometer, instrument to measure the urine. Urinary, pertaining to the urine, like urinary tract, or we call also urinary tract infection, UTI. Word building with urea, anuria, condition of no urine. It's for many causes. Bacteria or bacteriuria. It's bacteria in the urine. Dysuria is difficult or painful urination. Glucose or glucosuria, sugar in the urine. And hematuria, it's the blood in the urine. Ketone or ketonuria, it's ketones body in the urine. Word building with urea also. Nocturia, it's meaning nighttime urination. Oliguria, scanty urination or a few amount of the urine. Polyuria, frequent big volume urination. Proteinuria, protein in the urine. Biuria, it's pus in the urine, like in the figure here, like pus in the urine. Urinary system vocabulary. Anuria, It's complete lack of urine production and lack of urine excretion, like acute renal failure, or the shocked patient, he has anuria. Also, azotemia is nitrogenous waste in the bloodstream, like in chronic renal failure or acute renal failure. Calculus, stone formed within an organ from mineral salts. Stone or calculus. Catheter, it's a flexible tube inserted into the body, commonly through the urethra into the bladder. Diuresis is increased formation and secretion of urine. Enuresis, involuntary discharge of urine, also called bedwetting at night, like in the children, most likely to see this disturbance in the kids. Enuresis. Urinary system vocabulary. Here the nervous system, which innervation of the bladder and the internal and external sphincter and the bladder. Frequency, its meaning greater. Urge to urinate, no increase in total volume of urine. Frequency is meaning many times the body go to the toilet. Hesitancy is decreased in force of urine stream, often with difficulty initiating the flow, and he go without urination sometimes. Micturition, another term of urination. Nephrology, diagnosis and treatment of internal disease and condition of the kidney. Renal colic, it's pain caused by a kidney stone or other obstruction conditions. It's the kidney pain. Stricture, narrowing of the pathway in the urinary system, called stricture. Here, the main function of the bladder fills, detrusor muscle relaxes, and urethral sphincter contracts, and pelvic floor also contracts. First sensation to void, bladder half full, and the urination voluntary, inhibited until appropriate time. Sometimes the body in is not appropriate time for urination, so he can inhibit it or delay urination. Normal desire to void, when the bladder is more filled with urine. And micturition, the detrusor muscle contracts, and pelvic floor and urethral sphincter relaxes also, so the body can urination or voiding. Uremia, accumulation of waste products in the bloodstream. Urgency, it's feeling the need to urinate immediately without delay. Urinary incontinence, it's involuntary release of the urine, like in some patient, like neurogenic bladder, or elderly patient, or in the kids. Urinary retention, inability to fully empty the bladder. Also, we can call urinary retention like fecal constipation. So also here, post voiding residual volume, we can assess if the patient urinate sufficiency or not. Urology, diagnosis and treatment of disease and condition of the urinary system by the urologist. Voiding, it's another term of urination or micturition or peace. Here we also have another questions for all of you. You can write it in the chat. For number 1, can all type or write it in the chat. For number 1, 2, 3, 4, 5, 6, 7. Yes, cortex. Number 2. I'm waiting for your answers. Number 2. Yes. Number 3. Yes. Number 4. Number 4. Number 1, the cortex, and number 2, the medulla, and number 3, the calicus. Number 4, the pelvis. Yes, the pelvis of the kidney. Yes. Number 5. Number 5. Yes. Number 6, the pyramid, and number 5, it's the papilla of the pyramid. Number 7. Number 7. Yeah, ureter. Yes, ureter. Yes, thank you for all. Abu Taib and Dr. Hussam and Dr. Ahmed. Here, kidney pathology, normal kidney in the left side and hydronephrosis in the right side. You can see the obstruction on pelvic ureteric obstruction junction. Here, the UBJ, uretropelvic junction obstruction. Acute tubular necrosis, ATN, damage to the renal tubules due to toxin in the urine, result in oliguria. Acute tubular necrosis also caused by toxin to the kidney or glomerulus or nephron, or also in the shocked patient. Diabetic nephropathy, damage to glomerular capillaries due to high blood sugar of diabetes mellitus. Glomerulonephritis, inflammation of the kidney more permeable to the protein and the blood cells. You can see it in the urinalysis. hydronephrosis is distension of renal pelvis due to accumulation of urine in the kidney. Kidney pathology, nephrolithiasis, presence of calculi in the kidney, solidification of salt in the urine, nephrotic syndrome, damage to glomerulus protein appears in the urine, polycystic kidneys, formation of multiple cysts within the kidney destroys normal kidney tissues. So the ending of the patient with renal failure. Here in the figure, you can see the normal kidney and the polycystic kidney on the left side. Kidney pathology, pyelonephritis, inflammation of renal pelvis and the kidney, common type of the kidney disease, renal cell carcinoma, cancerous tumor of the renal tubule cells, most origin from the proximal convoluted tubules. Renal failure, inability of kidneys to filter wastes result in uremia. Wilms tumor, malignant kidney tumor, most often found in the children. Urinary bladder pathology, bladder cancer, cancerous tumor rising from cells lining bladder. Symptoms is painless hematuria. The main symptom in bladder cancer is painless hematuria without pain. Bladder neck obstruction, PNO. Blockage of the bladder outlet, often caused by enlarged prostate gland or the contraction of the bladder neck. Cystocele, protrusion of the urinary bladder into the wall of the vagina. Urinary bladder pathology, interstitial cystitis, inflammation and irritation of the bladder, and most the patients are female in the mid-age and very painful bladder. Neurogenic bladder, loss of nervous control leads to retention, and most now we see it's from spinal cord injuries. Urinary tract infections, UTI, you always see that in pediatric and OBG and in urology. The term UTI, it's called UTI, urinary tract infection. Infections of any organ of urinary system, usually from bacteria, begins with cystitis and may ascend into the ureters and kidneys. Clinical laboratory tests, blood sample taken for the serum creatine level are used to measure glomerular filtration rate. Also, a 24-hour urine sample collected. A urine sample is used to measure creatine level in the urine. Blood urea nitrogen, blood test to evaluate kidney function by measuring level of nitrogenous waste urea in the bloodstream. Clean catch specimen, or CC, clean catch specimen. It's a urine sample obtained after cleaning of the urinary meatus and collecting sample in the midstream. Creatinine clearance is test of kidney function. Amount of the creatinine in the bloodstream is compared to amount of the urine. Here, clinical laboratory tests, urinalysis, UA, a physical and chemical and microscopic examination of urine, urine culture and sensitivity, CS, tests of bacterial infection, attempt to grow bacteria on a culture medium in order to identify it, then determine which antibiotics it's sensitive to. We know the bacteria and most useful antibiotic to treat it. Here, urinalysis video, you can see confirm patient details, name and date of birth, and the hospital. Inspection color of urine, if straw colored or red or brown, and inspect clarity of urine, clear, cloudy, or frothy, and assess urine odors, and check urine dipstick expiry date, and you can see most useful parameters through the dipstick examination here. After removing the dipstick from the urine sample, you can compare with the colors of the dipstick control. So you can compare between the colors to determine where are the glucose or ketones or sugar or blood or pH or protein. Here, diagnostic imaging, cystography, contrast dye is placed in the bladder and then X-ray is taken outline bladder, cystography or cystogram. Excretory urography, EU, dye is injected into the bloodstream. X-ray traces the dye as it moved through the organ of the urinary system. It's also called another type. It's called also intravenous biogram, IVB, or now called also intravenous urography. Injecting a dye into the vein and then taken an X-ray to outline the renal pelvis. Some differentiate between AU and intravenous biograph or urogram. They called the urography for the IVU, intravenous urography, and the biogram for retrograde biogram. We will talk a few slides later. KUP, kidneys, ureters, bladder, abdominal X-ray showing the kidneys, ureter, and bladder doesn't use dye. It's the simple X-ray for the abdomen when the patient is lying. Retrograde biogram. Retrograde biogram, as we mentioned before, it's dye inserted through the ureter orifice to the outline the ureter and the renal pelvis for any filling defect or the narrowing or stricture in the ureter or stones or tumor in the ureter or pelvis. Finding cystourethropy, VCUG, it's most useful investigation for the kids who complain for recurrent UTI. We use voiding cystography for mainly for see the bladder and urethra and bladder neck for rule out if there are vesico-ureteric reflux, VUR. Colored enhanced retrograde byelogram X-ray. Endoscopic procedure. Here we see cystoscopy. It's a visual examination of the urinary bladder using the cystoscope. You can use the cystoscope through the meatus and urethra to see the cystoscope, the inside of the bladder through this scope of this instrument to see if there are stricture, if there are inflammation, if there are prostatic enlargement or bladder stone or bladder defect or bladder tumor. It's here you see in the figure flexible cystoscopy. Flexible, you can use it through local anesthesia, like insertion of the Foley catheter. And there are also rigid one. Rigid one, it has more anesthesiologist to give the sedation or anesthesia for the patient. It's more difficult than flexible one. Medical treatment. Here, the cath or catheterization. You see the Foley catheter. It's indwelling to the meatus and urethra and to the bladder, and there are a balloon inside the bladder, and the urinary collection bag. It's fixed to the leg of the patient. Catheterization, it's insertion of the tube through the urethra and into the urinary bladder. Extracorporeal shockwave lithotripsy, use of ultrasound wave to break up renal calculi. Hemodialysis, HD, is use of artificial kidney machine to filter the blood. Peritoneal dialysis, it removes waste using chemical balance solution placed into the peritoneal cavity. It's used the osmolality of solution to remove the waste of the blood. Catheterization, in the female catheterization. Here, extracorporeal shockwave lithotripsy, a non-invasive procedure using a high-frequency sound wave to shatter kidney stones. Here, this patient undergoing hemodialysis. Patient blood passes through the hemodialysis machine for cleaning. Here, peritoneal dialysis, chemical balanced solution is placed in the abdominal cavity to draw impurity out of the bloodstream. It is removed after several hours. You can see the solution go through the abdomen, through the catheter, and then the same solution go out and with positive of the waste outside of the body. Lithotripsy is crushing a stone in the bladder or urethra or the kidney. Meaterotomy, it's incision into the meatus. Nephrolithotomy, The incision to directly remove stone from the kidney, nephrolithotomy, or pyelonephrolithotomy, the incision to directly to remove stone from the pelvis and the kidney, also like staghorn stones. It's big stones like renal transplant, surgical placement of a donor kidney. Here, the figure illustrates location utilized for implantation of the donor kidney. You can see the origin of the main kidney in the flank, but the transplant kidney in the pelvis. So can anastomose the renal artery and renal vein for the pelvis vessels and the ureter to the bladder directly. Urinary system pharmacology, antibiotic, like treat bacterial infections like cybro or macrolide, antispasmodic, prevent or reduce bladder muscle spasm like ditropam, diuresis or diuretics, like increased volume of urine like Lasix or aldactone. Urinary system abbreviations: AGN, acute glomerulonephritis; ARF, acute renal failure; ATN, acute tubular necrosis; PNO, bladder neck obstruction; PON, blood urea nitrogen; CAF, from catheterization; CL, chloride; CRF, chronic renal failure; also called end-stage renal failure or end-stage renal injury; CS, culture and sensitivity; CAPD, continuous ambulatory peritoneal dialysis; CC, clean cath urine specimen, clean catch urine specimen; cysto, cystoscopy; and ESRD, end-stage renal disease or renal failure or renal injury, end-stage renal disease or renal injury. ESWL, extracorporeal shockwave lithotripsy; EU, excretory urography. I mentioned here the IVU or IVP. It's now we called it from the history investigation in the people or in the human, because they are harmful for the patient or the body, and we display it by CT scan. Genitourinary, GU, HCO3, it's bicarbonate; HD, hemodialysis; H2O, water; IO, input and output for the fluid balance; IBD, intermittent peritoneal dialysis, IVB, as I mentioned before, intravenous biogram, but now we don't make it anymore, exception with some exception only. Key plus potassium, TUB, kidney ureter bladder, X-ray, ml, milliliter, Na, sodium, NS, nephrotic syndrome, and in the drugs, normal saline also, nephrotic syndrome. Here, healthcare worker draining urine from a bladder catheter bag. You can see. Here, you can see the sectioned kidney specimen illustrating extensive renal calculi. It's called stag horn, like a horn of the animals. Micturition cystogram here, like in this video, you can see cystogram, voiding cystogram, micturition, cystourethrogram. Yes, here. The posterior urethra here, and the bladder neck, and the bladder. Here, after urination, there are small amount of waste voiding, and maybe there are UR. Here, the ureterogram. You can see the ureterogram in this figure. pH, RP, GR, UA, UC, UTI, VCUG. pH is acidity or alkalinity of the urine or the blood. Retrograde bilogram, specific gravity for the gravity of the urine. UA, urinalysis. UC, urine culture. UTI, urinary tract infection. VCG, voiding cystourethropy. Here, another question for the first lecture. If there anyone can answer it in the chat. Number 1. Can see the figure here. Can you write in the chat what you see in the number? Number 1. Number 1, Dr. Ahmed, it's efferent artery, not afferent. Efferent is go out of the glomerular, and afferent go to the glomerular. Yes, efferent. Yes, Abdurrahman. It's correct. Number 4, it's the afferent, which Ahmed say afferent. It's number 2. Number 2. Come on. I'm waiting. for your answer. Yes, it's correct. Thank you, Ahmed. Number 3. Yes, it's woman capsule. Number 3. There, all of you. Yes, glomerular. Thank you, Mahmoud. And number 5. The origin of the renal cell carcinoma. Number 5. I mentioned it before in this lecture. Number 5. Yes, proximal convoluted tubules. Yes. Number 6. Yes. Thank you, Abdurrahman. Number 6. Yes. Thank you. Number 7. Number 7. Yes. These are convoluted tubules. Number 8. Yes, collecting tube or collecting ducts. Number 9. Number 9. It's ascending and descending loop of Hanley. The number 6 is the descending loop of Hanley, and number 8, the ascending loop of Hanley. Number 10. Yes, thank you, Rasha. That's great. It's correct, all of you. If there are any question about this lecture, it's grateful for your attention and for your answers. Thank you for all of you. If there are any question, you can unmute or type it in the chat. It's good for all of you to speak only with English language or to discuss or ask in the Arabic some difficult in Arabic. It's good for you. Thank you for all of you. If there are any question, you can type it in the WhatsApp group, and we're grateful with you, and thank you very much for your attention and your interaction with this lecture. Thank you. See you later.